Good morning. I'm Dr. Sandy Smith and I'm coming to you from the Animal Health Clinic in Fenton, Michigan. And this is episode 4 of our Animal Tales. Today we're going to be talking about dental procedures and oral surgeries in dogs and cats. Probably most people don't realize that over 80% of dogs and cats by the age of 3 have already developed periodontal disease, and many of them have already developed endodontic disease. In case you don't know the difference, periodontal disease means disease of the oral cavity and around the teeth, and endodontic disease means disease within the tooth itself. So we have at our office a dedicated dental suite where I am currently standing. We have a number of instruments that are very important to our ability to do a dental procedure, which we call oral surgery. So I'd like to go through those with you just very quickly. We have over here a high-speed drill and an ultrasonic scaler and polisher. So what we do with these instruments is we scale off the calculus on the teeth. We do supra and sub, so above and below the gum line. Then we polish. If we don't polish, the teeth are actually more rough than we start, and it accelerates the rate at which dental calculus develops. If we have any teeth that are questionable, we will then move on to this piece of equipment right here, which is our digital dental x-ray. This allows us to look not only at the external surface of the tooth, but the internal surface of the tooth and all the structures that lie below the gum line, such as periodontal ligaments and teeth root. I'm assuming most of you have had dental x-rays yourself, so you probably know how these work. Once we have taken our dental x-ray, we're going to develop an image. It shows up on the computer because it's digital, and we're going to evaluate the crown of the tooth, we're going to evaluate the internal structures of the tooth, and we're going to evaluate the structures surrounding the teeth that keep them healthy and keep them in the jaw. We also have a dedicated light because we're working in a dark oral cavity, and we also have these funny little gadgets over here for magnification and increased light that we put on our heads, they're headlights, and we can look down in the oral cavity and get a better idea of what's going on. There we go.
All you want to do is lay down. It's okay. Okay, you're fine.
I need to get under it. 31, 2, 3.
And that keeps it makes a seal in the trachea, so nothing, water, anything gets down into his lungs during the procedure. check it, make sure you don't hear any air, and that means it's formed a proper seal. They are unable to blink under anesthesia, so we do move their eyes. I'm gonna flip them. Let's flip them on this side first. Okay. and a half. And we check their pocketing, which means their gingival pocketing. So I can get this under the gums on a certain distance on this tool, and then we put it there. And if there's anything concerning or a really deep pocket, then we will take a radiograph of that too.
Okay.
Where are you starting?
I'm starting left top all the way to the back. One. 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 Good, it's healthy. So I'm gonna polish to smooth out all those edges that scaling made, so bacteria doesn't have the opportunity to sit in there and collect. Which means he has good oxygen, good blood flow. I can see him breathing through his tube, so I'm watching that the whole time. Also, one thing is position of their eyes. They should be looking at their nose, which he is, and that means that they're in an appropriate level of anesthesia. So that's what I'm doing as I'm scaling, polishing, doing all that as well. And I'm listening to the heart rate and the pulse ox as well. So.
And that's that sound we're hearing is the blood moving through his body.
Yep. Yep. That's picking up on the blood movement in his
heartbeat. Excellent. Getting the mani-pedi while he's under too?
Yep. Every anesthetic procedure, we trim their nails and clean their ears. I'll do the top of this side and the inside of the bottom, and then I flip it, I'll do the top of that side and the inside of that bottom, and that covers all of its quadrants. Okay, bud. Can you come back a little bit more? Yeah. So we always flip them feet under, and that just reduces the risk of them getting like bloat or something from their stomach turning. So. To the other one, so you can see the tartar built up there, and we are going to remove that. And just like us when we don't floss, our gums bleed a little bit. We put in a catheter for every surgical patient because it allows us immediate venous access in case anything were to happen. We don't have to try and find a vein. It's already there. It's already ready. With our older patients, so over 7, we do require fluid, and that just helps their body metabolize anesthesia, and it helps get rid of those toxins, and also it helps their blood pressure stay at the level we want it. Yeah. Outside. One. 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 One.
A little bitter.
Yeah, this time I'm finishing.
Did you try muscular?
No, not yet. But I didn't know.
Bedtime already?
Yeah.
Wow.
So you can see all of his roots, and actually this white right here is a ligament that holds those teeth in, and then this is the cavity that holds all the muscles and the nerves, and this is what's called his crown and his root, and then all this is bone of his jaw.
So all looks good.
Mm-hmm. Looks perfect.
Good job, Blue. And this is the fluoride treatment. Give him a spit and polish, but he has to bring his own spit.
And I flush all the anesthesia out. So now he's just on O2.
So it's a combination teeth cleaning day spa.
Yep.
Yeah.
You want me, huh? Is that what you're trying to tell me?
It's just
In an indirect way?
courtesy to the owners.
Uh-huh.
Might as well while we're under. It makes it
Love
a lot
it.
easier.
So, dental x-ray, dental scaler, dental polisher, illumination, images, all help us determine the health of your pet, whether or not we need to extract teeth or perform some other type of oral surgery. So, February is National Dental Health Month. We've extended that to the veterinary world. We're offering 10% off all dental procedures and/or oral surgeries scheduled in the month of February. A couple other things I want to let you know the Animal Health Clinic is doing. We are having a whimsical painting in the end of February. It's a little abstract painting you can do with your pet with an artist. We'll show you how to do it. It's a lot of fun. We're going to be doing that here at the clinic. We're also continuing our laser therapy specials just to let people understand what laser therapy is and that it's now available in Fenton. We're the only one. And that's it. I thank you for tuning in, and I hope you guys have a great day.
If you're watching this show on Facebook, please click that share button and share this show with all of your friends. Subscribe to our YouTube channel. Go to the Facebook page, go to FentonTV.com directly. That's ideas at FentonTV.com. Well, thank you so much for watching. Stay tuned and be well.